All right, then. So this morning, the very first segment of the program, we are touching down on health, and we're looking at health on wheels, navigating the complexities of ovarian cancer. Let me bring my guest to the microphone. She's joining us on the phone line this morning. Dr. Bukola Oshikanlu is a clinical and radiation oncologist with NSIA-LUTH Cancer Center. Dr. Oshikanlu, nice to have you. Good morning.
Good morning. Good morning, everyone. Good morning, Lagos.
Right. Let's go down to the main crux of the matter this morning. We're talking cancer, and the reason we're doing this advocacy is just to empower people and give them the right information that is needed for them to take action. So we're touching down on ovarian cancer. What kind of cancer is ovarian cancer?
So ovarian cancer is a cancer that affects one of the reproductive organs in a woman, the one responsible for producing eggs. Okay, so the same eggs that does get fertilized by the sperm and eventually, if successful, results in a pregnancy and eventually birth of a live baby. So that organ responsible for producing the eggs in the woman, that is the ovary. So
right.
Cancer involving the ovary is ovarian cancer.
Right. So how common is this kind of cancer?
Yeah, it's relatively common among gynecology cancers. By gynecology cancers, I mean cancers occurring in women. Top amongst them is cervical cancer, followed by uterine, and then ovarian is next. So it's that common.
Right. And for those who might not really know, what's the difference between cervical cancer and ovarian cancer? Because, like you said, both of them are from the reproductive part of the woman.
Yeah, so for cervical cancer, it's cancer of the, in layman terms, mouth of the womb, okay? So, but the ovarian cancer is cancer arising from the ovary, the place where the eggs are produced. So cervical cancer is the commonest gynecologic cancer here in Nigeria.
All right. Well, so to put it in perspective, in terms of how common it is, I just need to give me some prevalence rates that we have. So if we have 10 women in a room, how many of them are likely to come down with ovarian cancer?
Okay, so for ovarian cancer, the average lifetime rate speaking generally now is about 1 in 70. And the median age of diagnosis is 63 years. So like 1 in 70 women have a lifetime risk of coming down with ovarian cancer.
Right.
So if there are like 10 women, like you say, in a room, so maybe like 1 or 2 of them, it's not so common, at least not in this environment. It's more common in Caucasians.
So it's more common with Africans? Is that it?
No, it is more common in the whites.
Okay.
In Caucasians,
right.
In whites, yeah.
Okay.
Yeah.
All right. So a lot of times we always look at causes and effects of things and concepts in life. And I know in medicine, you guys, you really talk on causes. So, but what are the risk factors?
Yeah, so for ovarian cancer, the risk factors can broadly classify them. We start with the reproductive risk factors. Okay, so the risk factors that can decrease the risk or associated with a decreased risk of ovarian cancer include 1 or more pregnancies or births. So, and usually the cutoff age for this is 35 years. So a woman who has had a child before the age of 35 is less likely to come down with ovarian cancer than one whose first childbirth or first pregnancy happens after the age of 35.
Oh.
Also, use of...
No, let's get clarity to that. So you're saying now that any woman who has a delayed birth, for instance, anyone from age 35 upwards, might likely come down with ovarian cancer. Is that it?
Yes. If you're having your first child after the age of 35, you're at more risk for coming down with ovarian cancer than somebody who has had a first child before the age of 35 years.
Why is that cancer discriminatory?
It's just it's the estrogen levels, really. So for someone who has delayed childbirth till after 35, the interplay between the hormones, because the ovaries produce hormones, the interplay between the hormones, the ovaries produce a lot of estrogens. So usually there's a cyclical change that's happening in a woman that results in menstruation. So cyclical change between levels of estrogen, levels of progesterone. So once a woman gets pregnant, okay, so that cyclical change, it's put on a hold, so to speak. So the ovaries are resting while she's pregnant. So, but if, it's been exposed all the while, so that does put the woman at more risk of coming down with ovarian cancer. And same goes for a woman who starts menstruating early. So a child who starts menstruating early, say before the age of 12, compared to a child who starts menstruating after 12 years, is more at risk for coming down with ovarian cancer.
Wow.
Same applies to a woman who stops seeing her period, later than someone who stops earlier. So a woman who stops seeing her period, say, like 55, compared to one who stops seeing her period, like 48 years, is more at risk for coming down. So basically that estrogen window being the period where you're fertile, you start seeing your period, and the period between when you start seeing your period and when you stop seeing your period. So the longer it is, the more at risk for coming down with ovarian cancer you are.
And Dr. Oshikanlu, these are natural phenomena. I mean, there's nothing one can do about that.
Oh, yes, there's nothing we can do about that. Yes, you're right. So another risk factor is use of oral contraceptives. So women who use oral contraceptives, it is actually protective. Use of oral contraception decreases your risk of coming down with ovarian cancer. Another one is breastfeeding. Breastfeeding also decreases your risk of coming down with ovarian cancer.
Oh.
So, and the time limit for that is breastfeeding at least 6 months. Less than 6 months is not necessarily protective.
Oh, good.
So the longer you breastfeed, the more protection you get against ovarian cancer.
Right. So on the one hand,
factors which increase.
Yes.
Yeah, go on.
So I'm trying to say, on the one hand, we have factors that could increase your likelihood of contracting it, but on the other hand, you also have ways that you can mitigate it. That's what it means.
Oh, yeah. Oh, yeah.
Let's touch down on the symptoms now. So what are the signs that would show a woman that she is coming down with ovarian cancer?
Yeah, sadly, ovarian cancer in the early stages is what we call asymptomatic. No signs, no symptoms in the early stages. Okay. So, but when it's advanced, and sadly, the case, most women with ovarian cancer, they come when it's advanced. So, when it's advanced is when we start seeing symptoms. So, symptoms you'll find are symptoms like what we call easy satiety. You get full very easily. You just eat little amount of food and you're like, oh, I'm full. So other symptoms could be like some bloating. You feel bloated.
Okay.
So and sometimes too, if you start experiencing frequent urination, you're someone who before you don't have any issues with urinating so often, and all of a sudden you start urinating so often, and it comes up most days of the month, say more than 12 days in a month, and you can't really attribute this to anything else, any other benign condition or any other malignant condition, then you probably need to check out if there's anything going on in your ovaries, like ovarian cancer.
Right.
So, so those are some of the symptoms that you would experience, or generally pressure symptoms, sometimes to constipation. You just get constipated, you are eating all the fibers, your diet is good, high in fiber, and everything else that contributes to your bowel output are on point, but you're still constipated. Then you need to check it out.
So there's nothing like bleeding from the reproductive part?
Yeah, sometimes, very rarely, you could have some women bleed from ovarian cancer. The bleeding part is more from, cervical cancer or endometrial cancer. And as a matter of fact, if a woman is presenting with bleeding and the pointers are pointing towards ovarian cancer, it is advisable that she does get an endometrial biopsy just to rule out the fact that the ovarian cancer may have spread through the endometrium. So bleeding is not so common in ovarian cancer, but it can occur.
Right. So is ovarian cancer easily diagnosed?
Yeah, so easily diagnosed, if we want to talk about screening, it's not something that can be easily screened for, okay? So, but some measures that can be adopted for screening ovarian cancer can be doing what we call a transvaginal ultrasound scan. Transvaginal ultrasound scan meaning that the probe is put into the woman's vagina as opposed to being placed on the abdomen. So the transvaginal ultrasound scan is better for helping with diagnosing ovarian cancer than the transabdominal ultrasound scan. And also another test that can be done is a tumor marker that we call CA125. A tumor marker, by the way, is a chemical that the levels increase when there's cancer somewhere in the body. So we have different types of tumor markers for different types of cancers. So for ovarian cancer, the tumor marker of concern or of note is what we call cancer antigen 125.
All right.
So if a woman does the cancer antigen 125 and it is elevated, normal range is from 0 to 35. So if a woman does cancer antigen 125 and the level is above 35, it's up to 60, then that's more than double, or about double, then she needs to screen seriously for ovarian cancer.
Okay, so the big question on the minds of our listeners this morning will be, is it, I mean, like other cancers, you can walk into a facility now and say, look, let me do a screening for cervical cancer, let's check out there are lumps here in the breast, let's do some screening for prostate and all of that. Is it possible for that one to do that too? And how often can one do that for ovarian cancer?
Yeah, so most guidelines that we as oncologists work with in taking care of our cancer patients, they do not have any recommended screening measures for ovarian cancer. But like I said, if you have suspicion that you might have ovarian cancer, the tests to do transvaginal ultrasound scan, and that can be available in most reputable diagnostic centers. You don't necessarily need to go to hospital for that. You can just walk into any reputable diagnostic center and ask to do a transvaginal ultrasound scan. And you can also ask to do the cancer antigen 125 blood test. Like the cancer antigen 125, by the way, it's a blood test. So they just take a blood sample from you and run the cancer antigen 125 test to know whether it is elevated or not. So these are the tests that you can do. And yes, they are available in reputable diagnostic centers.
All right, then Lagos Traffic Radio 96.1 FM. This morning, we are navigating the complexities of ovarian cancer, and we're learning a lot. Dr. Bukola Oshikanlu is taking us to the classroom. She's a radiation and clinical oncologist with NSIA-LUTH Cancer Center. I have a very big question for her, but before then, there's one here coming in from one of our listeners. This one says, good morning, Dr. Bukola. Do you believe the government is doing enough to prioritize cancer care in Nigeria? Or Layemi from Ifako is sending that one in. So, add to what Olayemi have just asked, do we have enough care for cancer generally in Nigeria?
Yeah, in terms of facilities for cancer management, I would say the government is trying. We at the NSIA-LUTH Cancer Center, we're one center here in Nigeria, but other oncology centers are also coming up around the country. So yes, we may not be the ideal yet, or we may not be the basically we may not be what every Nigerian will clamor for in terms of number of facilities. But yes, there are some facilities in cancer centers in Nigeria providing this care. So I would say the government is doing its best, but it can do better, especially in terms of funding for cancer care.
All right.
So having the facilities is one thing, and then having the funds to seek this treatment or seek care in these facilities is another ballgame entirely.
Right. Okay. So the big question is ovarian cancer curable?
Ovarian cancer, if it is detected in the early stage, it is very curable. If it is detected very early, it is curable. But in the advanced stages, no.
Okay.
Okay, for example, if it has spread already, because cancer diagnosis from any part of the body, it's a diagnosis or it's a disease that has the ability or propensity to spread. For example, ovarian cancer starts, and if it's not detected early, or even if it is detected early, treatment is not instituted early, it can spread. So once it's spread from the ovary to lungs or liver or any distant organs, at that point, it is not curable. Doesn't mean the patient can't receive treatment. There is treatment, but the treatment that would offer would be to improve the patient's quality of life, make the patient reduce symptoms as much as possible, and make the patient as comfortable as possible. Okay, so but if it is detected early when it hasn't spread, it's just still in the ovaries or in the adjoining fallopian tubes, then yes, it is curable.
All right. Another question here says, good morning, Victor. Ovarian cancer is like a silent threat. Why is it so difficult to detect early? You didn't put your name, but thank you so much. Is that the way you refer to it, Dr. Oshikanlu?
Yeah, so like I said, most patients with ovarian cancer, they come late, and that is because really the symptoms are non-specific. If you recall, I said earlier that we have symptoms like bloating, we have symptoms like early satiety. An average doctor, when you go to an average doctor and complain of bloating or early satiety, they would be thinking more of disease coming from the gastrointestinal tract, perhaps the stomach or somewhere up there in the gastrointestinal tract, as opposed to in one of the gynecologic organs. So that's why it poses that. So when the patients start complaining about this, and go to an average doctor, they are looking somewhere else as opposed to looking to the ovaries, But with a high index of suspicion, and if you are able to see somebody who is oncology oriented in his or her thinking, a doctor who is oncology oriented, then they may be able to help out to send you to do a scan that may be able to pick up the tumor early.
All right, then more questions here.
That's why, yeah.
All right. More questions here. Says, good morning, Victor and Doctor. Please, are there any early warning signs that women, especially in their 30s and 40s, should not ignore? Bimbo is asking that question. Thank you so much, Bimbo.
So like I said, early warning signs are for ovarian cancer, when it is in the early stage, it is asymptomatic. It's just going in there. It won't give you any symptoms. It's when it's become advanced that you start seeing symptoms like early satiety, bloating, urinary frequency, constipation that I talked about. And sometimes really you can also have vaginal bleeding from ovarian cancer. So, but in the early stages, there's really no symptom. Okay, so since that is the case, sometimes some people do, or there's this thing called health screening. So if you are somebody who does health screening, it's very important that as part of your health screenings, you at least include an abdominal pelvic ultrasound scan, because there are different packages for health screenings, and some of them do not include an abdominal pelvic ultrasound scan that may be able to view the interior or the internal organs, right from the liver down to the gynecologic organs, the uterus, the ovaries, the tubes, and all of that. So perhaps if you adopt a healthy lifestyle of doing regular medical screenings and you include abdominal pelvic ultrasound scans in your screenings,
right,
you may be able to pick something up already.
Okay, then. So let's see if we can run this up. But I still have some questions coming in here for you. This one says, good morning, Victor and Doctor. Please. Okay, no, I've taken that one. This one says, what do you tell a woman who just got diagnosed and is overwhelmed by fear? Buchi is sending that one in. Thank you so much. So what would you tell that kind of a woman?
Yeah, so being overwhelmed by fear, not a surprising feature at all when it comes to cancer diagnosis, because many people, once they hear cancer, that is the first thing that happens to them. They're really overwhelmed, and they're so fearful and afraid of many things, both the diagnosis itself and the financial implication of getting treatment. So for those kind of women, for those kind of patients, when they do come around, I do my best to, first of all, start with, because the cancer diagnosis, you need to know the stage. You start by knowing the stage. Because like I mentioned earlier, if it is early, it is curable. But if it is late, it may not be curable, but there is treatment. So we start by knowing the stage. When we know the stage, and if you're lucky, it's an early stage, of course, some of the fears will come down a little bit, okay? Because if it's in the early stage, like I said, it is curable. So we start by knowing the stage, and after knowing the stage, we then counsel the patient on the treatment modalities available. And for ovarian cancer, if it's in the early stage, surgery is one of the treatment modalities. If you're able to take out the entire tumor, it's very good. And after surgery, you can then offer the patient chemotherapy.
All right.
Now, chemotherapy is one treatment modality that many patients are really, really scared of. Once they hear chemo, they are like, oh my God, I don't even want chemo. So as part of what we do at the NSIA-LUTH Cancer Center, we do our best to counsel patients and allay their fears as much as possible as regards the stage of the cancer they have come with, also as regards the treatment modality that we're offering them. So we counsel them on all the possible side effects, and we try as much as possible to allay myths about, whether chemotherapy or even the cancer itself that they may have, come with from outside.
Right.
Yeah, so we do our best to allay these fears as much as possible. So it's very important. One of the things to do when you do have a cancer diagnosis is to see specialists, people who are dedicated to taking care of cancer patients, as opposed to seeing just any general doctor, so that as much as possible those fears are allayed. All
right. Flash update coming in from the control room. Report of a broken down petroleum tanker at Randok, Okiafa, in what Kpako is Solo. It's having a gas problem. That's Randok in what is Solo. So the driver, I understand, is making efforts to get it fixed and evacuate it. Having minimal effect on traffic at the moment, so even though it's slow movement, already caused by bad portions of the road at Okiafa. All right, so take note of that. Let's round this off right now. Dr. Oshikanlu, what's the message to our listeners, and how can we ensure that we improve women's health by paying more attention to ovarian cancer?
Yeah, so the message to listeners today is ovarian cancer is not a death sentence. Ovarian or any cancer diagnosis at all, it's not a death sentence. So if you do get diagnosed with ovarian cancer, do please very early, once you have been diagnosed, bring on board an oncologist or see an oncologist, okay, so that you would be, taken through the right path, towards receiving treatment and receiving the care that you should receive. Because instituting treatment early, diagnosing it early, if possible, instituting treatment early, these are very vital and key to overcoming and to getting a cure and a good outcome at the end of the day.
All right, we'll leave it at that for now.
And also adopting a healthy lifestyle is very important, because smoking is also one of the risk factors for ovarian cancer. So you can quit smoking; it will be very helpful. Also, obesity, if you're too much on the big side, so you can cut down on your diet and watch what you eat, so that you're not too much, in terms of weight. You're not obese, so to speak. Yeah, that would also help.
All right.
So another risk factors that we talked about, if you can modify your risk factors as much as possible, then your risk for ovarian cancer and indeed other cancers would also be minimal.
Okay, then. So, Dr. Bukola, we have to look for a day to get you into the studios, and then we can have a wider conversation on this particular kind of cancer. Thank you so much for connecting with us.
All right, thank you. Take care.
Okay, then. So she is Dr. Bukola Oshikanlu, who is a radiation and clinical oncologist with NSIA-LUTH Cancer Center right here in Lagos, Nigeria. And I can tell you, she is fellow of the West African College of Surgeons, Radiation Oncology, and of course a member of the Association of Radiation and Clinical Oncologists of Nigeria. A short break. When we return, we'll do our birthdays before we switch gears to how we can leverage insurance for maximum outcomes in life.